That first warning sign, sudden dizziness or lightheadedness, is one of the most misunderstood signals your body can send you, especially as you get older. Many people experience dizziness at some point and immediately explain it away. You might think you stood up too fast, didn't drink enough water, skipped a meal, or didn't sleep well the night before. And while those things can certainly cause brief lightheadedness, dizziness linked to reduced blood flow to the brain has a very different quality to it. It often comes on suddenly, without an obvious trigger, and it can feel unsettling in a way that's hard to describe. You may feel unsteady, as if the ground beneath you isn't quite solid, or as if your head feels floaty or disconnected from your body. When the arteries in your neck begin to narrow, the brain may not receive a steady supply of oxygen-rich blood, even for a few seconds. The brain is incredibly sensitive to changes in blood flow, and when it doesn't get what it needs, one of the first reactions is dizziness. This can happen while you're sitting quietly, watching television, or even lying down, which is a key difference from common dizziness caused by standing up too quickly. Some people describe it as a spinning sensation, while others feel like they might faint or lose control of their balance. It may pass quickly, sometimes within seconds or minutes, which is exactly why it's so easy to ignore. What makes this symptom especially dangerous is how often it repeats quietly. You might feel dizzy once, shrug it off, and then experience it again days or weeks later. Because it doesn't always come with pain, many seniors assume it's just another part of aging. But aging alone does not cause sudden, unexplained dizziness. Reduced blood flow to the brain does. Each episode can be a sign that the carotid arteries are struggling to deliver enough blood, particularly during moments when your brain needs it most. Another important detail is how this dizziness can affect your confidence and safety. Even mild lightheadedness increases the risk of falls, which can be life-changing for older adults. A brief loss of balance can lead to broken bones, head injuries, or long recovery periods that reduce independence. When dizziness is caused by blocked arteries, the risk goes beyond falls, because it may also signal an increased risk of stroke. The brain is essentially telling you that it's not being properly nourished, even if only for short periods. This type of dizziness may also come with other subtle sensations, such as blurred vision, nausea, or a strange pressure in the head. You may feel unusually tired afterward or mentally foggy, as if it takes longer to think clearly. These are not random experiences. They are connected responses to changes in blood flow. Paying attention to when dizziness happens, how often it occurs, and whether it's becoming more frequent or intense can provide critical information that should never be brushed aside. Sudden vision problems, especially when they affect one eye more than the other, can be one of the most alarming yet commonly dismissed warning signs of blocked arteries in the neck. Many people assume vision changes are simply part of getting older, blaming tired eyes, cataracts, or needing a new prescription for glasses. While age-related vision issues do exist, there is a clear difference between gradual changes and sudden, unexplained disturbances that come out of nowhere. When vision loss or blurring happens abruptly, even if it lasts only a few seconds or minutes, it should always raise concern because it can be directly linked to reduced blood flow through the carotid arteries. The eyes and the brain share a close relationship when it comes to circulation. The same major arteries in the neck that supply oxygen-rich blood to the brain also send blood to the eyes. When plaque builds up inside these arteries, it can restrict or briefly block blood flow, and the eyes may be one of the first places to show it. Some people describe the experience as a dark shadow or curtain moving across their field of vision, while others notice flashes of light, grey areas, or a sudden blurring that makes it difficult to focus. This type of vision change often affects only one eye at a time, which is a key detail many people overlook. What makes this symptom especially dangerous is how quickly it can come and go. Vision may return to normal within minutes, leaving you questioning whether it even happened at all. Because the symptom disappears, people tend to dismiss it as eye strain or momentary fatigue. However, this temporary loss of vision can be a warning sign of a transient ischemic attack, sometimes called a mini stroke. It's the body's way of signaling that blood flow to critical areas is being interrupted, even if only briefly. Each episode increases the risk that a more severe and permanent event could follow. These vision disturbances can also be accompanied by a sense of pressure behind the eye, mild dizziness, or a headache on the same side. Some individuals feel disoriented or anxious during the episode, not fully understanding what's happening. The fear may fade once vision returns, but the underlying problem remains. Ignoring these signs allows plaque buildup to progress silently, increasing the likelihood of a full stroke that could result in permanent vision loss, disability, or worse. It's also important to understand that this symptom doesn't always occur in people with known eye problems. Even those who have always had good eyesight can experience sudden vision changes related to carotid artery narrowing. This is why routine eye exams alone may not catch the problem. A deeper look at vascular health is often needed to identify the true cause, paying attention to sudden changes, noting how often they occur, and recognizing patterns can provide critical clues that something more serious is developing beneath the surface, making early medical evaluation an essential step in protecting both vision and brain health. Weakness or numbness on one side of the body is one of the most telling warning signs that blood flow to the brain may be compromised. Yet it is still surprisingly easy for people to brush off when it doesn't last very long. You might notice that one arm suddenly feels heavy or clumsy, as if it doesn't quite respond the way it normally does. Sometimes it's a tingling or pins, and needle sensation in the hand or fingers, and other times it's a noticeable loss of strength that makes it harder to grip objects or lift something light. In some cases, the face is affected, causing a slight droop or numb feeling on one side that can be felt when smiling or speaking. This happens because the brain is divided into regions that control movement and sensation for specific parts of the body. When an artery in the neck is narrowed or partially blocked, blood flow to certain areas of the brain may be reduced. If the affected area controls movement or sensation on one side of the body, that is where the symptoms will appear. The change can be sudden and frightening, but when it fades after a few minutes, many people convince themselves it was nothing serious. They may blame a pinched nerve, poor circulation, or simply sleeping in an awkward position. What makes this symptom particularly dangerous is that it is often a sign of a transient ischemic attack, sometimes referred to as a mini stroke. During these events, blood flow to part of the brain is briefly interrupted and then restored. The symptoms resolve, but the underlying issue remains. Each episode is a clear warning that the risk of a full stroke is increasing. Studies have shown that a significant number of strokes are preceded by these short, lived episodes of weakness or numbness, sometimes days or weeks in advance. The experience can vary from person to person. Some individuals notice difficulty walking, as one leg feels weaker or less coordinated. Others feel off balance or unsteady, especially when trying to move quickly or change direction. Fine motor skills can also be affected, making tasks like buttoning a shirt, writing, or picking up small objects suddenly more challenging. These changes can feel subtle at first, but they are not normal and should never be ignored. There is also an emotional aspect to this symptom that often goes unspoken. Feeling your body suddenly not respond the way it should can create anxiety, fear, and confusion. You may hesitate to tell anyone because you don't want to overreact or cause worry. But silence is what allows serious conditions to progress unnoticed. Paying attention to which side of the body is affected, how long the sensation lasts, and whether it happens more than once can provide crucial information to a healthcare provider. Recognizing these warning signs early gives you the best chance to take action, restore healthy blood flow, and reduce the risk of long-term damage to the brain and body. Trouble speaking or understanding speech is one of the most unsettling warning signs a person can experience, because communication is something we rely on every moment of our lives. You may suddenly find yourself knowing exactly what you want to say, but the words come out slurred, jumbled, or incomplete. In other cases, you might speak clearly but realize that the person listening looks confused because your words don't make sense. Sometimes the issue isn't speaking at all, but understanding what others are saying to you, as if their words are familiar sounds, but the meaning just doesn't connect the way it normally would. This happens because specific areas of the brain are responsible for language, comprehension, and speech coordination. When blood flow to these areas is reduced due to narrowing or blockage in the carotid arteries, the brain struggles to process language efficiently. Even a brief disruption in blood supply can interfere with the complex signals required for clear communication. What makes this symptom especially dangerous is that it can appear suddenly and disappear just as quickly, giving the false impression that everything has returned to normal. Many people explain these moments away as fatigue, stress, or simple forgetfulness. Seniors in particular may assume they are just having an off day or that it's a normal part of aging, but aging alone does not cause sudden difficulty speaking or understanding familiar language. When these changes occur abruptly, they are often signs of a transient ischemic attack, which is the body's urgent warning that the brain is not receiving enough blood. Each episode is a serious signal that the risk of a full stroke is rising. These speech-related symptoms can take many forms. You might notice that your tongue feels thick or heavy, making it harder to pronounce words clearly. You may pause frequently while speaking, struggling to find simple words that normally come easily. Some people experience difficulty following conversations, especially in group settings, feeling mentally overwhelmed or slow to respond. This can lead to frustration or embarrassment, causing individuals to withdraw socially rather than seek help. There is also an emotional impact tied to these experiences. Losing the ability to communicate, even briefly, can be frightening and disorienting. It can shake your confidence and create fear about what might happen next. Unfortunately, that fear sometimes leads people to stay quiet instead of speaking up. Ignoring these signs allows plaque buildup and restricted blood flow to continue silently, increasing the likelihood of permanent damage. Paying attention to sudden changes in speech or comprehension is critical. Noticing whether the problem affects speaking, understanding, or both can provide important clues about which part of the brain may be involved. Even if the episode lasts only a few minutes and then resolves, it should never be brushed aside. Recognizing this warning sign early creates an opportunity for medical evaluation, preventive treatment, and lifestyle changes that can dramatically reduce the risk of a major stroke and help preserve both brain health and independence. Unexplained headaches that feel sudden or unusually intense can be a subtle but important warning sign of reduced blood flow to the brain. Unlike common tension headaches, these may appear without a clear trigger and feel sharp, heavy, or different from what you normally experience. They can come on quickly and may be accompanied by dizziness, vision changes, or a sense of pressure in the head. Because they often fade, many people dismiss them as stress or fatigue, but headaches linked to narrowed arteries can signal changes in blood pressure or circulation within the brain that deserve careful attention.